Restraint. When attempting to restrain mice, sudden, jerky moves should be avoided to decrease the likelihood of being bitten. Approaching mice with gentle confidence is best. It is important to select the appropriate method of restraint for the procedure you wish to perform, and one that will offer the best access to the area requiring manipulation. If you have questions concerning restraint selection, please consult your veterinarian. Restraint by the tail or with forceps is only intended for short-term manipulations, such as transferring animals from one cage to another. Mice may be picked up by grasping the base of the tail. Do not grasp the tip of the tail, as this may cause the skin to be stripped off. This method is used only for brief restraint, for example, transferring animals from cage to cage. Never suspend the mouse for prolonged periods of time by its tail. Using the scruff or mechanical devices is suggested for procedures requiring more than momentary restraint, such as injections or blood withdrawal. Restraining the mouse by this scruff will allow you to perform many technical procedures, such as examination, injection, and blood collection. There is a one-hand and a two-hand variation of this technique. The one-hand method places you at greater risk for being bitten, so beginners should perfect the two-hand restraint method before attempting the one-hand method. For the two-hand technique, restrain the mouse by grasping it near the base of the tail and placing it on a toe-gripping surface, such as a wire bar lid. Pulling back gently on the tail of the mouse causes it to pull forward on the toe-gripping surface. Caution must be used to avoid injuring the tail or toes of the mouse. While grasping the tail with one hand, grasp the nape or scruff of the neck with the other. Position the animal's body firmly across your hand by extending your forefinger and thumb back as far as possible, while maintaining a firm grip on the scruff. Place the tail between the fingers of this same hand to secure the animal. This type of restraint will allow the handler complete access to the ventral side of the mouse. Again, caution must be used. If you do not grasp enough of the scruff, the animal will be able to turn and bite. If you grasp too much skin, the airway will become restricted and the mouse will become cyanotic. Monitor the condition of the animal the entire time it is restrained, being careful to observe the breathing rate and color of the ears, nose, and oral cavity. The animal should be released immediately if there are any signs of gasping or change in coloring from pink to blue. For the one-hand technique, restrain the mouse by grasping it near the base of the tail and placing it on a toe-gripping surface. A good example of an appropriate surface is the wire bar lid. Place the base of the tail between or underneath your last one or two fingers. With the thumb and first finger of the same hand, grasp the nape or scruff of the neck. The same precautions as described for the two-hand technique must be followed. Plexiglass restrainers are available from several different manufacturers in a variety of styles. They allow the user to have both hands free from manipulation. Depending on the type of restraint device, the mouse is placed in the restrainer either tail or head first. If it is a head first restrainer, you can use a variety of methods to encourage the mouse to enter the restrainer. Restrain the mouse by the scruff, as described earlier, and direct its head into the opening. Once you release the scruff, most mice will readily enter the restrainer. If the restrainer has a securing device, affix it firmly to prevent the mouse from exiting the apparatus. Alternatively, grasp the mouse by the base of the tail with one hand and cover the top of the restrainer with the other to form a darkened tunnel. Most mice, once they are shown the entrance to the tunnel, will readily enter the restrainer. Affix the securing device. Tail-first restrainers are appropriate for procedures such as tail vein injections and blood collections. If you are using a tail-first restrainer, grasp the mouse by the base of the tail and slide it hindquarters first into the restrainer, using the slot as a tail guide. Once the mouse is in the restrainer, insert the securing device to prevent the mouse from exiting the apparatus. Use caution when placing the securing device to prevent injury or restriction of the animal's breathing. Monitor the breathing rate and color of the ears and nose for the duration of the restraint. Release the animal immediately should there be any signs of gasping or change in color from pink to blue.
Restraint. Rats are gregarious animals and respond well to positive human interaction. It is important to handle them gently and in a caring manner. Proper handling will in turn help avoid stress responses that often manifest as aggression. If they will be on a study that involves regular restraint, it is important to acclimate them to handling before the study is initiated, and to handle them without experimental manipulation during the course of the study. It is also helpful to stroke them prior to full hand restraint, which will help to calm and relax them prior to being picked up. Using hand restraint or a mechanical device is suggested for procedures requiring more than momentary restraint, such as injections or blood withdrawal. There are multiple techniques for hand restraining rats. The method selected will depend on the size of the animal and the experimental manipulation to be performed. 4 methods will be shown here: scruff, scissor, half Nelson, and cross arm. Note, for large rats, 2 people may be needed for proper restraint. At all times during the restraint, you should observe the color of the ears, nose, and oral cavity, and the rat's breathing rate. The animal should be released immediately if there are any signs of gasping or change in coloring from pink to dark red or blue. For the scruff restraint, grasp the rat near the base of the tail. While holding the tail with one hand, grasp the nape or scruff of the neck with the other, collecting enough loose skin between the thumb and forefingers to prevent movement of the head and shoulders. At this point, the tail can be released and the rat can be held against the surface for techniques such as subcutaneous injections, or picked up for techniques such as oral gavage or intraperitoneal injections. In general, rats are easier to pick up and restrain than mice. However, if a rat is resisting restraint, then moderate pressure can be placed over the body and shoulders, pressing the rat onto the restraint surface until control is gained. For the scissor restraint, grasp the rat near the base of the tail. While holding the tail with one hand, slide the other hand up the back, positioning the index and middle fingers on either side of the neck, gripping the sides of the mandible. The thumb and ring finger simultaneously slide behind the forearms into the armpits and around the rib cage. For the half Nelson restraint, grasp the rat near the base of the tail. While holding the tail with one hand, slide the thumb of the second hand under the armpit till it touches the rat's nose. The fingers of the second hand then curl and grasp the loose skin, forming a fist. This action will in turn rotate the rat's extended arm up and outward. For the cross-arm restraint, grasp the rat near the base of the tail. While holding the tail with one hand, slide the other hand up the back, positioning the thumb and fingers on either side of the shoulder blades and upper arms. After reaching this position, lift the rat while pressing the arms across the rat's chest. When using a mechanical restrainer, Restrain the rat by the scruff as described earlier, and direct its head into the opening. Once you release the scruff, most rats will readily enter the restrainer. If the restrainer has a securing device, affix it firmly to prevent the rat from exiting the apparatus.
Different types of ear punches are available. Ear punches should be sterile prior to initial use. Extra ear punches should always be available as they become dull with repeated use. To identify the mouse by ear punch, restrain it by the scruff using one of the methods demonstrated in the restraint section of this CD. The punch should be placed approximately 3 millimeters from the edge of the ear pinna. If the punch is placed too close to the edge of the pinna, it is likely to tear and become difficult to read. You should also be careful not to place the punch too far toward the inside of the ear to avoid injuring the animal. The tissue removed with the ear punch can be used for genotyping.
Most commonly, genotyping of mice is accomplished by amputating a small portion of the distal tail. This is best performed when the pup is 10 to 15 days old. 5 millimeters or less of the distal tail is removed for this procedure. The tail is sprayed with a topical hypothermic prior to collection of tail tissue. As an alternative to the topical hypothermic, the animal may be anesthetized. A scalpel or scissors can be used to remove the tissue. The instruments are sterile at the beginning of the procedure and sanitized with Clydox, Alcide, or other appropriate disinfectant between animals. You must assure that adequate hemostasis has been achieved before returning the animal to its cage. Surgical glue, silver nitrate, or direct pressure with a sterile gauze pad can be used for this purpose.
Intramuscular injection. Regardless of the method used for intramuscular injections, it must be noted that the sciatic nerve runs along the length of the femur. It is very important to avoid injuring this nerve. This is best accomplished by pointing the tip of the needle away from the femur and sciatic nerve. It is also important to make sure you utilize a good restraint technique. If the mouse or rat is allowed to kick or struggle, this could cause injury to the muscles or the nerve. It is best to swab the area with 70% alcohol before placing the needle and to aspirate to look for blood before injecting. One of the following methods may be used. Method 1. Restrain the mouse by hand. Insert the needle bevel up into the caudal thigh muscles at a 45-degree angle. After aspirating, slowly inject the material. Since the foot is not secured, avoid injecting the mouse if it is kicking. Method 2. Restrain the rat by hand. Pull the foot of the rear leg on the thumb side of your hand across the rat's body and secure it with your little finger. This provides additional control of the leg and helps prevent movement during injection. This method also provides better exposure of the injection site.
Subcutaneous injections. Restrain the mouse by the scruff method. Use your thumb and forefinger to make a tent of skin over the scruff. Prep the area with 70% ethanol. Insert the needle bevel up at the base of the tent. The needle should be inserted parallel to the skin and should be directed toward the posterior of the animal. Aspirate to ensure proper placement and inject the material. Intraperitoneal injections. Restrain the mouse by the scruff method. Expose the ventral side of the animal, tilting the head down at a slight angle. Prep the site with 70% ethanol. The sterile needle should be placed bevel up in the lower right or left quadrant of the animal's abdomen. Insert the needle at a 30-degree angle. Aspirate to ensure proper placement and inject the material. Intravenous injections. Warm the mouse under a heat lamp or other heating device, being sure not to overheat the animal. The temperature should not exceed 85 to 90 degrees Fahrenheit at the level of the animal. Remove the mouse from the heat source immediately should any change in respiration rate or excessive salivation be observed. Other heating devices, such as disposable hand warmers, may be used in lieu of a heat lamp. Place the animal in a restraint device and stabilize the tail between the thumb and forefinger of the hand that will not be manipulating the syringe. Prep the tail with 70% ethanol. Attempt the injection starting at the middle or slightly distal part of the tail. With the tail under tension, insert the needle bevel up, approximately parallel to the vein, and insert the needle at least 3 millimeters into the vein. Do not aspirate, as it will cause the vein to collapse. Inject the material in a slow, fluid motion. You should be able to see the vein blanch if the needle is properly positioned. If any swelling at the injection site or resistance to injection occurs, remove the needle and reinsert it slightly above the initial injection site. Intradermal injections. In order to perform intradermal injections, the mouse should be anesthetized. Shave or pluck an injection site on the back of the animal to remove the hair. Swab the site with 70% ethanol. Insert the needle into the skin, bevel up, holding the needle nearly parallel to the plane of the skin. Do not aspirate. Inject the material. The volume of the injection should be limited to 50 microliters per site to avoid tissue trauma. A properly performed intradermal injection will result in a small, round skin welt. Oral gavage. Gavaging is used to dose an animal with a specified volume of material directly into its stomach. Only a specialized, commercially available gavage needle should be used for attempting this procedure. Fill the syringe with the appropriate volume of material and attach the needle. Restrain the animal by the scruff. Place the tip or ball of the needle into the animal's mouth. Slide the tip gently past the back of the tongue. The needle should slide easily down the esophagus if properly placed. Do not force. If any resistance is met, remove the needle and reinsert. Do not aspirate. Once the needle is properly placed, administer the material.
Mandibular vein. The mandibular veins drain the eye and submandibular areas of the face, and they provide a convenient site for consistently obtaining larger volumes of blood. In addition, if serial blood samples are needed, they can be taken by alternating between both sides of the face. Restrain the mouse by the scruff with a secure hold around the face and neck area, while maintaining the mouse's head in a symmetrical position. Locate the calyx hairless area at the angle of the mandible, which serves as a landmark for the puncture site. Puncture the site with a small gauge needle or sterile lancet and collect the blood into an appropriate container. Release the hand restraint to stop the bleeding and to assist hemostasis. Saphenous vein. Blood collection from the saphenous vein is considered an alternative method to retroorbital bleeding. The saphenous is a superficial vein located on the rear legs and has a lateral and medial component. Both components can be accessed for venipuncture and can serve as alternating sites if multiple blood samples need to be taken over the course of an experiment. For both methods, it is best to use a mechanical restrainer made by taking a 50 milliliter conical centrifuge tube and cutting an opening in the coned end to allow for ventilation. You should then pluck the hair away from the site of the vein, which is on the lower leg surface at the footpad hair interface. Alternatively, you can coat the area with a small amount of petroleum-based ointment. Hair plucking is often easier performed while hand restraining, but ointment should be placed once the mouse is in the tube and the leg is isolated. Place the mouse head first into the tube, holding onto one rear leg with your thumb and forefinger, while using the palm of your hand to cover the opening. Gently press the medial surface of the leg at the inguinal level, between the rim of the tube and your finger, or over the rim of the tube, which serves as a tourniquet and allows blood to collect in the vein. Once the vein is visible, puncture the site with a small gauge needle or sterile lancet, and collect the blood into an appropriate container. After completion, ensure good hemostasis. This site is also accessible on rats. For rat restraint, use a regular mechanical restrainer and pluck the hair from the site. A rear leg is then pulled out and trapped between your fingers, again applying pressure to the inguinal area to allow filling of the vein. Once the vein is visible, puncture the site with a small gauge needle or sterile lancet and collect the blood into an appropriate container. After completion, ensure good hemostasis.
Tail nicking is a survival procedure that can be used to collect up to 200 microliters of blood from the lateral tail veins. This method must be used with caution, as when improperly performed, permanent tail injury or amputation may occur. Warm the animal under a heat source, being careful not to overheat. The temperature at the level of the animal should not exceed 85 to 90 degrees Fahrenheit. Place the mouse in a restrainer. Prep the tail with 70% ethanol. Stabilize the tail with the thumb and forefinger of the hand that will not be used to nick the tail. Using a number 11 scalpel blade, gently nick the lateral tail vein in the general area around the midline of the tail. Start at least halfway down the tail so that if there is a problem, you can nick the tail above the initial site and still obtain your blood sample. When an appropriate volume has been collected, ensure good hemostasis with a dry, sterile gauze pad, surgical glue, or silver nitrate.
Tail vein. Warm the animal under a heat source, being careful not to overheat. The temperature at the level of the animal should not exceed 85 to 90 degrees Fahrenheit. Alternatively, heat can be applied to the tail directly, using a disposable hand warmer or warm, damp gauze pads. Place the rat in a mechanical restrainer and stabilize the tail between the thumb and forefinger of the hand that will not be manipulating the syringe. Attempt the collection starting at the middle or slightly distal part of the tail. With the tail under tension, insert the needle bevel up, approximately parallel to the vein and at least 3 millimeters into the vein. If the puncture is not successful, then remove the needle and reinsert it slightly above the initial puncture site.
Retroorbital sinus blood collection. The retroorbital sinus is the site located behind the eye at the medial or lateral canthus. This venous sinus is located just underneath the conjunctival membrane. This method is intended for survival blood collection. Restrain the mouse by the scruff method. It is imperative that the mouse be properly restrained. If the mouse is allowed to move its head, severe injury to the eye or surrounding tissues could occur. A topical ophthalmic anesthetic must be used prior to performing this procedure. Apply 1 drop of an anesthetic, such as proparacaine or tetracaine hydrochloride, to the eye. Be careful not to touch the tip of the applicator to any part of the mouse. This will cause contamination of the anesthetic. Wait 5 to 10 seconds after the anesthetic is applied before attempting this procedure. Gently blot away excess anesthetic with a clean gauze pad, being careful not to scratch the cornea. An alternative to topical anesthesia for this procedure is general anesthesia. With a gentle rotating motion, insert the tube through the sinus membrane. Continue rotating the tube at the back of the orbit until blood flows. Collect the appropriate volume of blood. Upon completion, ensure good hemostasis with a clean gauze pad before returning the animal to its cage. Be careful not to scratch the cornea with the gauze pad. Intracardiac puncture. Intracardiac puncture must be performed under deep anesthesia and is considered a non-survival procedure. Once the mouse is deeply anesthetized, prep the ventral chest area with 70% ethanol. Insert the needle at the base of the sternum, bevel up, into the thoracic cavity at a 15 to 20 degree angle directed just to the left of the midline. Aspirate slowly. If blood starts to flow into the syringe, continue to aspirate with steady, even pressure. If no blood is seen, reposition the needle and attempt aspiration.
Carbon dioxide euthanasia. Compressed CO2 gas is the only recommended source of CO2 for euthanasia. Carbon dioxide generated from dry ice is unacceptable. Mice and rats are typically euthanized in their home cages or may be transferred to a specially designed euthanasia chamber. After placing the mice or rats into an appropriate holding device, locate the instruction chart for your CO2 chamber equipment. This will provide flow rates that have been calculated for your equipment in conjunction with common cage or chamber sizes used by your facility for mice and rats. An optimal flow rate should displace 10 to 20% of the chamber volume per minute until the mouse or rat is unconscious. This flow rate is associated with a rapid loss of consciousness and minimal distress to the animal. With an animal in the chamber, set the flow meter level at the prescribed rate for that species. You'll notice that the animals will become drowsy and will start showing uncoordinated movements. After 1 to 3 minutes, they will stop moving and become unconscious. Once the animals are unconscious, the flow rate should be increased to the maximum level, and the animals monitored for a lack of breathing as an indication of death. When breathing has stopped, maintain the gas flow at the maximum rate for at least 1 additional minute to help ensure death. Once death seems assured, then the gas flow should be turned off and the animals removed from the chamber. Death should then be verified by feeling the chest for the absence of a heartbeat, by performing cervical dislocation, or by perforating the chest wall and diaphragm.